Hey y'all, and welcome back to the Connect Network TV on the CW. Right now, we are being joined by founder and entrepreneur, advocate, author, educator, and public speaker, Connie Alleyne. Hi, Connie. Welcome to the show.
Hi, thank
We
you,
are
thank you,
so
thank
happy to
you.
have you looking lovely and beautiful. Welcome.
Thank you. Thank you so much for having me.
Yes. Well, it is Women's History Month, and we want to give you your flowers, Connie, for the work that you've done to really help communities. Even before starting your own foundation, you were an educator for a very vulnerable population. Can you tell us a little bit more about that first?
Sure. I started my correctional journey back in 2000. So I was a prison health services administrator for almost 2 decades. So I had been working to help the incarcerated population, and then kind of transitioned into the founder of the Civilian Corrections Academy, where we provide training to non-uniform staff who go to work in the correctional environment. I'm also a criminal justice professor. Um, pro, so it's very interesting, adjunct, but I was just honored by the school for their women in movement and in excellence event. So that was just amazing, just to see that even as an adjunct criminal justice professor, bringing real world experience into the classroom, that I can also still be recognized for that work in the space. And then came the Kendall Wyche Foundation.
I love that. Let's learn a little bit more. You offer a very unique approach to supporting your clients. Can you tell us a little bit more about what programs and resources you have at the foundation that help you stand out?
Sure. So the foundation is called Kendall Wyche Foundation. It's Rising Above Diabetes. Essentially, we have 38.4 million Americans living with diabetes, and of that, 304,000 are children and adolescents. So the reason why we came about in general was just that I am a mom of a type 1 diabetic. My daughter was diagnosed at age 9, and we've been on this journey of how do we get her the support? How do I get support as a caregiver? And then thankfully, I had the wherewithal to be able to advocate for her. But what about those individuals who are unable to do that? And so, based on our experiences as we're navigating this world of diabetes for the last 4 years now, it is setting up programs that kids will actually engage in. So we have one program called the EAT program, and it is enriched awareness of type 1. And what we do is partner with nutritionists and with chefs to get them healthy foods that taste good. The other initiative, which is going to be our flagship event, we're hosting in August. So we're super excited, but it's called Field of Dreams. So we have a ton of educational workshops and material that we've developed and that we're going to be rolling out to those families that are in need. And we've got a few other initiatives, but I know our time is limited, so I'm not going to run my mouth too long. But I'm excited about this journey. I think there's so much to be done for this community, even if it's just a matter of us doing our part to educate and help to bridge that gap of health equity. We know that African Americans don't have the best outcomes as it relates to diabetes care. And we also don't always have access to the education that we need. So the foundation is serving to sort of fill that gap.
Absolutely. I mean, I really admire the work you're doing because when you said health equity, I'm like, yes, that is it. We think about economic, right, equality, but health is so important. So I would love for you to talk more about diabetes in general. It became an epidemic in 1994. Do you think there is enough awareness surrounding this epidemic? And what have you been most surprised to learn about diabetes during your studies?
Well, so here's the thing. I think diabetes has been around for a long time, right? I think our reality is that there are a number of great organizations out there trying to make a difference. There's tons of research happening. We hear about all the different developments, all the treatments that are out there. So there's this stuff happening. I just think that with the large number of individuals who are impacted by diabetes, I don't know that we have enough resources out there to truly impact the disease in a manner that it no longer is an epidemic, right? Like from my experience, I've had the ability to engage with a number of organizations. And sometimes, yes, I think education is a big part of it, right? Because people think, I know how to take care of myself, right? I know what to eat, right? But they're not recognizing these spikes in their blood sugar and the impact that that has long term. You know, a lot of times we talk about like, so what does it look like if we provide treatment in this area versus that area, right? Like a lot of the clinical trials, all the stuff, right? There's a lot of movement, I think, surrounding diabetes and diabetes management and education. However, I don't know that we're always able to impact the communities where we see the most significant, I guess, prevalence of diabetes.
That's very interesting. And I'm just curious because I feel like diabetes disproportionately affects the Black community. And I would love to know why. Have you looked into this? Is this a part of your education in the
Yes.
program?
So yeah, we're actually still discovering all the whys, right? I think there's always a why, right? I think sometimes it's a funding issue, depending on which institutions are located in your area that you may have access to. The level of treatment or care they have available may not be the best, right? And I'm not going to say that across the board, but I'm just going to say that funding is definitely a challenge in some communities where, you know, they've got like a clinic, right? Like they've got maybe one treatment center and their catchment area is this big, right? Like I think there's so many moving parts as it relates to that. I think also too, when you think about coverage, like, you know, there's been some good developments in Medicaid expansion and all other types of medical coverage. But like, if you can't afford to pay for insulin, if you can't afford an insulin pump or a continuous glucose monitoring device, right? There's not really, you're still back to the manual process, right? And so in our community, there are times where we don't have the information translated in a way that's culturally competent, right? In a way that we can receive it. And we got to get out of this. I just got a little sugar, right? You don't just have a little sugar. We have to be able to articulate what diabetes is in the language that we know the care providers are going to understand in case they're not culturally competent. To know that you talking about you got a little sugar means you're diabetic and you're probably not managing it well.
Unfortunately, that is all the time we have, but how can we get involved to support the cause? What is the best way to connect with you?
For sure. So I can be reached at info@risingaboveddiabetes.org. We are on Facebook, the Kendall Wyche Foundation. We are on Instagram. We are on TikTok. We're kind of everywhere trying to get the word out, trying to spread the news, trying to educate. And now we're in the process of connecting to some really great organizations to really help us amplify our voice.
You know what? Thank you so much, Connie, for all the work that you do. I absolutely love earlier you said you became an advocate for your child and then you saw a void and filled that with your foundation. So just thank you for everything you are doing. And do not move, DMV, because coming up after the break, we have London Knighton with entertainment news you do not want to miss out. See you soon.